Thanks to Professor Milton Liang for invitation. Why PGT-A hypothesis is wrong, explained by Hereditics. Hereditics is a complete study of heredity, include both genome and cytoplasm. Hereditics include genetics and epigenetics, also include cytohetics and epicytohetics. According to cytohetics, cytoplasmic hereditics, cell is the basic unit of a heredity. Gene is the basic unit of a heredity messenger. In some conditions, genetics is not absolutely related to heredity. First fact, many diagnosis and diploidy or mosaic embryo by PGT-A produced baby is 99.9% they are with the normal karyotyping. Second, many babies born from the old-present transfer, MRT, mitochondrial replacement therapy. They do not touch or change oocyte genome, but the baby, many of them with the neuropathy and immune problem. In hybrid experiment, more harm of the cytoplasm produce more abnormality offspring. In clone horse, we use the same genome or DNA, but they will produce many different kinds of the cytotype, so the owner know every of the different of the clone horses. So both of the genome and cytoplasm are hereditary material. In cytoplasm, not just the mitochondria, but also cytoskeleton, endoplasmic reticulum, centrosome, they are all inherited. This is the central, and this another central, and the centrosome is around there. So we all know no cell division, there will be no cell-to-cell heredity. In each of the somatic cell cycle, chromosome, cytoplasm, centrosome, they all duplicate. Each of them control the heredity action, cell division. It is centrosome. Centrosome is the headquarters of a microtubule, actin, microfilament, and Golgi. It is also the headquarters of the cell cycle and cell division. Centrosome also contains the cell cycle checkpoint lysin system to form the heredity control system. It contains more than 300 different proteins. It consists of the pre-initiation complex of the DNA replication, and also they control the DNA replication. When there is a DNA damage during replication, and then the checkpoint lysin system to make sure G2 will not go to the metaphase, so they will stop there. So during cell cycle, DNA replication and centrosome central duplication, they all coordinate together. So there are about 3 different checkpoints in the cell cycle. And the heredity control system also controls the spindle assembly to make sure the microtubule connect to the chromatin firmly, and they will not lose to produce any aneuploidy or cancer cell. That is when DNA has some damage, their replication some problem, and then no mitotic exists. So the cell heredity stopped. That is why heredity control system control DNA replication, centrosome duplication, and spindle assembly. Mitotic exists is the switch of the heredity, control cell-to-cell heredity and life-to-life heredity. In embryogenesis, some gene is silent. And also PLK4, RB, V1, they all silence. Others, like cyclin E, they're active. This is the balance of the checkpoints in the embryogenesis. Some activate, some silent. To produce more aneuploidy or polyploidy cell, no mistake in the checkpoint system. It makes sure some DNA replication, sometimes without cell division, so produce some polyploid cell. That's why in human embryos, in parasite, in fungi, in human liver, and human nervous system, they all contain some aneuploidy and polyploid cell for the adaptation to stress in the environment. That is why almost 100% human embryo are mosaic. Some aneuploid cells, they are the embryonic biological function. They help for the cell differentiation and for the embryo fast villi implantation. After the embryo implantation finish, because the embryo contain the normal heredity control system, and then they slowly to clear out all of the aneuploid cell and produce almost all of the baby, they are all normal karyotyping. That's why in the fetus only 0.2% aneuploid. Only when the checkpoint and license system in an embryo is defective, it will develop into the genetic disease. That's why hereditary disease are the concurrent defect of the both DNA and heredity control system. In genetics, there is the basic principle is the patient's hereditary disease. That means it's the biological trait. It equal to whether this embryo contain normal or abnormal heredity control system. So the basic principle of genetics is neglected in the PGS. That's why we should differentiate true or false PGT, true or pseudoscience. PGT, D diagnosis, T test for mutation. They are all according to the patient's family history, so they are the true PGT. But PGS, as for screening, PGT-A for aneuploidy, they are not according to the principle of genetics. That's why they are the pseudoscience. There is the components of the genetics. The genetics contain two parts, DNA and gene, and the second part, family biological trait. But PGS only contain DNA lack of this second part. That's why PGS is not the true genetic test. This is the first prize for the PGT in the world in 1991 for mice and 1994 for cystic fibrosis. Later, for sex determination of the PGT published. And Hereditics group said they use a fluorescent in situ hybridization method better than PCR. And we answer, almost all of the embryo would be judged as the mosaic by the FISH methodology. The first hypothesis of PGS is Milnet said that is diagnosing and preventing inherited disease. They are supported by the Walensky group. But in CHR, we answer, the mosaicism is the philosophical phenomenon rather than the true mosaicism. In year 15, Robert Kleicher, they published the paper, normal births after transfer of an embryo reported as aneuploidy. And later, more baby born after transfer mosaicism embryo, they are always normal karyotyping. And year 19, up to 800 normal babies born. This is to show the PGS positive predictive value, PPV, is only 0.1%. But based on the patient's hereditary history, PGT is so 99% PPV. It is significant different from the PGS in PPV. They are so highly significant difference. The second hypothesis of PGS is implantation and pregnancy rate would improve and miscarriage